Patty Stewing. She's from Milford, and 3.5 years ago, her daughter Amber died of cancer when she was only 4 years old. Patty kept a journal about Amber's life and about her death. Now, since Amber died, she's been devoted to learning about cancer and getting that word out to others. Now, before we start, I want to mention that we will be showing some pictures of Amber, and some of them may be a little disturbing to you, but we think that they're valuable, and we think that they're important, and we think that they'll be meaningful for you. I want to start off, of course, by having you briefly describe Amber's story.
Well, in August of '79, I discovered a small lump behind Amber's ear.
And she was about how old at that time?
She was 3.5. My first thought was cancer, and I only knew how to spell the word. I really didn't know what it was. And so I took her all around the state of Connecticut for the next 6 months, trying to convince the doctors to biopsy. Many of the doctors said, don't worry about it. Lots of kids get lots of lumps and bumps. I just wasn't satisfied with that. In March of '80, she fell and hit the tumor, which was now about the size of a fist. And within 2 weeks, it doubled in size. And I took her to Yale New Haven Hospital, had it removed, and 3 days later, the results came back from pathology that it was rhabdomyosarcoma, which is a cancer that arises of a skeletal muscle tissue, and that it was in the 3rd stage.
What was your feeling at that point after having gone through months of doctors telling you that this was just some part of the normal growth process and nothing to worry about?
Well, to say the least, I was a little bit hesitant to proceed with the chemotherapy and radiation. I thought, you know, all along that I was telling them it was cancer, and they were saying, don't worry about it. How could I believe that chemotherapy was the answer? So what I did is I made a public appeal. I went to the New Haven Register, and I asked the public if they knew of any other cancer therapies. I've got hundreds of replies back, and spent the next month just sorting through all those therapies, calling doctors all over the world to try to find the cancer therapy that made the most common sense.
Did you feel that a lot of the responses that you got, and some of the ones that you maybe even investigated, were snake oils, so to speak, that they were somebody's wish or dream, or did you feel that they all had some legitimate angle to them?
I do. I think that most cancer therapies do have some value. And I hope that eventually that all cancer therapies will be fed into a computer, and then the information be analyzed for their value. Because I do believe that there's more to cancer and cancer therapy than just the traditional treatment.
Most people do, though, accept the traditional treatment, radiation or chemotherapy or a combination of both. Other than the fact that you were somewhat dismayed by the medical community at this point, was there something in particular about those treatments that you just couldn't face, or that you just didn't feel confident or comfortable about?
Well, to me, personally, they didn't make any sense at all. It didn't make sense to take a poison and bombard Amber's system with a poison. And a lot of the side effects of chemotherapy cause cancer themselves. It made more sense to me to try to strengthen her own immune system through well, in the beginning we used vitamins and diet. It made more sense to me. I tried to use my common sense.
Now, you eventually went to the Bahamas, to a clinic that has been very controversial and has gotten a lot of write-up, but there have been a lot of patients there. And the basis of that treatment, as I understand it, is Laetrile.
No, he doesn't use Laetrile at all. Basically, the therapy involves taking good human blood and extracting 5 protein fractions. There are many that make up the immune system, but Dr. Burton has extracted 5. He works with 5. He takes it and isolates these 5. Then from the cancer patient, he draws blood, or the technicians draw blood, and they measure these same protein fractions. They measure these levels and make up for whatever levels are lacking with these injections, little 1 cc tuberculin syringes injections, so that your own immune system is fighting the cancer. So he doesn't use drugs.
Now, ultimately, of course, that was not successful in her case. Do you feel that it was a bad therapy, and do you feel that maybe you made a mistake in selecting that, or?
Well, you see, I don't think that it wasn't successful. As a matter of fact, I have slides of the first tumor, which was hard, white, and bony, and therefore they said it couldn't possibly be cancer. And I have the slides of the second metastasis that grew back, which was necrotic. It was pussy and dead tumor cells. So I believe that the cancer therapy did work for Amber. The fact that she died had a lot to contribute to the fact that she got tonsillitis while we were down there, and her body, her immune system was working too hard. And also rhabdomyosarcoma is very rapidly developing, so basically the cancer got ahead of us. I think perhaps if we could have gone down there in the very beginning, not that she would be living today, but perhaps she could have lived a little bit longer and we could have controlled it a little bit better.
Now, at some point during her therapy, you decided to seek the help of a surgeon and you left the Bahamas. That also did not work out.
When we flew to Montreal, the Canadian surgeons were a little bit hesitant just because there was like a 3-inch hole in her skull and they were afraid that, you know, it would be more complicated to operate at that time.
At that point, you must have felt that you were resorting to a dramatic measure and then they didn't give you what you had hoped for. At that point, what does a mother do?
Well, through the whole experience, basically I listened to God, or the supreme power, whatever you may call it, and therefore I really didn't have to make a lot of the major decisions that had to be made. You know, I just listened and tried to stay open and tried to do the best for Amber. So, you know, I basically just followed what God had to say. So after we left Montreal, we went back to the Bahamas and intensified the therapy, hoping to control it. She started to experience pain in her head, and then we just decided that we would come back to the United States, and we contacted Bernie Siegel, who was a New Haven-based surgeon, and he agreed to help us. We put her in St. Raphael's to do extensive testing, and at that time just decided that it had gone too far, basically, and just to get into the rest of her life and document it so that I could help others that were going through it.
And your basic thought at that point was not to continue a desperate struggle against a disease that at this point you must have accepted was going to take her life, but to try to enrich what was left of her short life.
Right, that's right. Bernie helped us deal with that very well through spontaneous drawings and basically just to accept death as not being the end.
Amber, for such a little girl, seems, from what I have read in the document that you've written about her, seems to have had a very insightful understanding of what was happening to her. Tell me a little bit about what she would say to you.
Well, I think most children do. I think that Amber was an extraordinary child myself. Basically, she knew what was happening to her. She knew that her body was dying. She would be quite frank about her cancer. When I interviewed her, I did interview her about the cancer. And I said, Amber, what would you say to other little children that had cancer? And she said, well, I would just say, you know, not to get cancer and to go to Dr. Burton's clinic to get better. One day, about 2 weeks before she died, in the middle of the afternoon, just right out of the blue, I was walking by her and she called me over and said, Mom, she goes, come here. She goes, I know I'm here to help a lot of people. And when she said that to me, it just struck me because I had kept the journal and knew that I was going to write the book. But the fact that she knew that she was put on this earth to help a lot of people is one of the things that's kept me going.
What can her story do to help other parents and other children?
Well, I'm hoping that through Amber's story and her struggle with cancer, that it will touch people's hearts and souls so that they can see that cancer is really a disease that can be prevented. A lot of it can. In my research, I came up with a figure of 80% of all cancer is caused by the poisoning of our environment. So I began to question, if 80% is caused by the poisoning, then 80% can be prevented. So that's why I have such a thrust towards preventing it. Just because Amber's dead and she's gone and she's out of pain, but the fact that all the other little children and adults who are suffering right now, that doesn't have to be if the world was cleaner.
What would you tell parents also about cancer therapy?
I would say use your common sense and intuition and try to keep an open mind about all cancer therapies. I wish there was more information available to people. When I asked Yale New Haven, this is all there is, chemotherapy and radiation, they said, yes, Mrs. Calistro, this is all there is. You know, and I left there shaking my head saying, God, there's got to be more. So I don't think that the information that the hospitals are giving you are as accurate or as thorough as it can be.
Mm-hmm. And you think that people shouldn't be afraid to at least explore other therapies that may sound radical or may sound like a departure from the establishment. But what advice would you give them in terms of not getting caught up in a therapy that ends up being disastrous in the end? I mean, there is the danger of turning down a therapy that might be effective in favor of something else. How do you advise them on that?
Well, as I said before, I think the best thing to do is to listen, you know, just to take a time of peace and quiet and to listen for the input that you have. With Amber's therapy and with Amber's life and her death, I can honestly say I have no regrets at all. I did everything that I should have done. I said everything I should have said, and I think a lot of it had to do with the fact that I used my common sense and the resources that were inside me. So I would say, you know, peer pressure, and a lot of people try to tell you, well, do this and do that, and what about this and what about that? But the fact is that being a parent, you have to make the final decision. Mm-hmm. So I think the thing to do is to listen to yourself and listen to your inner voice, and then you won't have as many regrets, I think.
And that's your advice on how to keep a clear head and keep a rational mind and keep thinking, is to listen inside.
And also educating yourself. Mm-hmm. I tried to read a lot of books about death before she died, mm-hmm. and I tried to educate myself so that I could be prepared as much as I could. Mm-hmm.
Patty, thanks for coming and talking to us today. It's a very sad story in a way, but it's very moving story to see that it has moved you to do something with your life to try to help other people with this. And when we come back, we are going to be speaking to another person who also has met cancer head-on and has seen it in her own life, and is going to tell us how she helps other people deal with the reality of cancer and with the reality of bereavement when we come back.
It's the law.